Hi, everybody. Thank you so much for joining us today. Where's my cursor? There we go. All right, thank you so much for joining us today. I'm sure you know that you are with the School of Health and Rehabilitation Sciences with the University of Pittsburgh, but just in case, SHRS, that's who you're talking to today. Today, it's not just me from the Dean's Office over in SHRS. I am Nicole Skelly Fitzgerald. I am the Director of Recruitment and Enrollment. I also have Jessica McGuire, the Director of Admissions, and Dr. Kathy Kelly, Associate Dean for Academic Outreach and Advising. Before we get started, you know, the normal housekeeping, keep your microphone muted. You can type any questions you have into the chat box. And we will get to them. So the first 30 minutes today, we're going to talk about all the SHRS updates. We'll cover questions at the end of that 30 minutes. And then when we talk to the programs, we'll cover the program questions before we move on to the next program, just to give you an idea of the structure there. And then you are welcome to use your video feature, but if you don't want to, that's okay. So our goal over this 5-week series is to first and foremost answer your questions about the School of Health and Rehabilitation Sciences. We want to provide you with the answers to the questions you have today and share resources for the questions students are going to ask you tomorrow. I always want to remind you, I'm going to emphasize through this entire hour that we are here to help and we are here to answer your questions. We're always happy to talk to you and the students as well, whether they're high school families or current undergrads or really anybody. Put them in touch with us. We are absolutely happy to talk with everyone. Let's kind of start from the beginning. Who is the School of Health and Rehabilitation Sciences? Well, SHRS is a nationally renowned leader in the field of healthcare education, research, and clinical practice preparation. With 13 different disciplines related to health and rehabilitative care, SHRS shapes future generations of healthcare professionals, therapists, counselors, advocates, scientists, providers, and practitioners, all trained to serve the needs of people regardless of background, levels of health, or mobility. We are built on a legacy of academic excellence and innovation and fueled by passionate educators and researchers, allowing us to meet the healthcare and rehabilitation needs of today and drive meaningful change for the future. SHRS is an upper division school with 5 undergraduate programs, 2 accelerated, and 23 plus and counting clinical and research focused graduate programs. We don't have time to discuss everything that we offer. It's a lot of programs. So we're going to stick with the ones that we believe are most relevant for the students that you're going to be talking to. Of course, if you come up with questions about anything we don't cover through this series, by all means, reach out, talk to us. We are happy to come and chat, virtually or otherwise. So the SHRS general updates that we're going to run through today, we've changed our general education requirements. We are adding some new guarantee admission programs. And then more generally, we have new programs. We have new digital resources and we are growing our staff as well. So let's start with our updated general education requirements. I am going to pull Jessica McGuire into the conversation here because she is admissions. She is all things prerequisites and she'll be able to give us some context here. So Jess, why have we made changes to our general education requirements?
So we have moved to align our general education requirements with the Dietrich School of Arts and Sciences. The majority of our students, oh, I'm so happy to see you're cheering. The majority of our students do come from the Dietrich School. So we hope that this move will help them have an easier time identifying the different courses we accept for each of our requirements. All of the general education requirements are either incorporated into each individual program's admission or curriculum requirements. But this is the general framework that everything is built on moving forward. And this will be effective for students entering the University of Pittsburgh in the fall 2021. So they have adequate time to plan for the change. And we do encourage any students who may be considering an upper level program at SHRS for fall 2022 to take a look at this, but it will not be required until 2023.
Okay, well, you just answered all of my questions in one go, so thank you. Do you guys have any questions about these general education requirements or what our goals are here?
Have you guys published this information on your website yet, or is that upcoming?
It's upcoming.
We're working on it.
Cool.
And we'll have it organized so that it's very clear for the students who are applying to start with us in fall 2022, what their requirements are, which are the current requirements. And then for the students applying thereafter, it'll be very clear. So everyone should hopefully not get too confused. We're gonna jump to the next slide. And I am always happy to go backwards if something comes up. Now, I know that there were some questions about the guarantees, so if you want to start typing those into the chat, or you can wait and we'll have a conversation once we go through a little bit of information. If you're not familiar, guaranteed admission programs are offered to qualified incoming first-year students. We are introducing some new guarantees in the upcoming admission cycle. So for students admitted to Pitt fall 2022, those new guarantees are going to be for rehabilitation technology, sports medicine, and sports science. And we're also changing our communication science and disorders guarantee. We're splitting it into an audiology guarantee and a speech language pathology guarantee. Students can complete any undergraduate major for these guarantees, except for audiology and speech. We do need those students to complete the communication science undergraduate program in order to move into those graduate, either of those graduate programs. Now, what questions do you guys have about the guarantees? So the gist of the guarantee is as long as students maintain the criteria, regardless of their undergraduate major, except for audiology and speech, of course, as long as they maintain the criteria, they're guaranteed into that graduate program. I know one thing I guess I always want to mention when I talk about sports medicine is this is not an MD program. This is a master's program, so it's not clinical. I suspect that question is going to come up a few times in the future. If you have any questions about these guarantees or what students should be doing or how they stay competitive or what additional requirements, truly anything, you can reach out to Jessica or I. We kind of co-manage the guarantees and are both very aware of all of the requirements and everything. Okay, so this is where it really gets fun. SHRS is growing and not just a little bit and not slowly. This past year, we have introduced and revised 4 of our programs. Our rehabilitation technology program is now being offered as a hybrid program, a 1-year hybrid program. Physical therapy has shortened its program down to 7 semesters and added a hybrid option. Our physician assistant studies department has introduced a hybrid PA program. And then our athletic training program is now an accelerated BSMS degree and also available as a master's program. All right, we have a question in the chat. Now that arts and sciences and CGS are admitting students and are doing test optional, if they have their tests waived for algebra because of completing a requirement in high school with a B or better, will you waive it for your students as well? Or will they still need to complete an algebra? Jessica?
That varies by program. Most of our programs do accept the exemption. There are 2 programs that do not. That is health information management and communication science. they need students to have college algebra or higher math.
So back to our new and revised programs, we're going to talk with rehabilitation technology and physical therapy later today. Physician assistant studies is going to be with us next week, and then athletic training will be with us the following week. One important distinction that I want to mention now, because it's, of course, there's variation in how these hybrid programs are being offered, but for physical therapy, it's still one doctor of physical therapy program. It's just being offered in two different modalities. So we're calling these options. You can complete the program in a hybrid option or a residential option. For physician assistant studies, these are two distinct programs, different start terms, different applications. It's two distinct items rather than PT, which is the same thing offered in two different ways. Athletic training is only available in person. This has moved from a bachelor's degree to an accelerated master's or master's program. And that's due to a change in the certification requirements for the field.
Okay, great. I saw it was revised. I couldn't catch which thing was revised. So it's becoming a completion program for like masters, right?
Yes.
Okay, great. Thank you.
Also, rehabilitation technology is only offered in the hybrid format.
Marketing and communications and admissions and recruitment, we've been very busy the past couple of weeks building out some new digital resources. We wanted to make sure that we are addressing all of our audiences really specifically on the website. So we've made a couple of changes. Let's go to the website. All right, so first I want to point out our new program finder. Rather than a very long list of all of the programs that we offer, you can now search. Maybe you have a student who's looking for an online or hybrid program. You can check out which programs are just online and hybrid. You can look for just our bachelor's degrees, just our certificates. You can also search by discipline. We're really excited about this reformat. I think it's way easier to digest personally. And then we have some new admissions pages. First, for high school students who are interested in the School of Health and Rehabilitation Sciences, understanding what is an upper division program, what are the different professions we can help them enter, some information for these students. Possibly a little more relevant to you guys would be our pages for prospective undergraduate and prospective graduate students. So for our undergraduate students, we've broken down our different programs, given a little bit of detail about, communication science is great to prepare you not only for audiology and speech, but also for occupational therapy, counseling, and other programs. Emergency medicine is great if you want to enter the field, the EMS field as a paramedic, or go on to physician assistant studies, medical school, or something else. So there's some of those details on this page, not only what programs are available, but where are they going to help you go? And then if you scroll down to the bottom of the page, there's different ways to get involved. Some community engagement opportunities, such as through our wellness pavilion, different opportunities for research and how students can get involved before they're a student in SHRS in research that our faculty are engaged in, what student groups are out there and available. And then my favorite thing that we've added to the website through all of this is this list of SHRS courses. These courses are available to students in their first and sophomore years, and some available for juniors and seniors as well. But this is a great opportunity for students to get a little taste of what these fields are like and what these programs are like before they apply or commit to the programs. Try it before you buy it is how I always talk about this. And there's a fair number of options here. Most of these courses you can just enroll in. There are a few that require a permission code, such as the emergency medicine's EMT course, which is super popular, and that's why they have that permission code kind of filter over everything. And there's information on how to get that permission code straight from the site. So this really gives students the opportunity to explore what these different fields have to offer and whether or not it's a good fit for them. And then we have our prospective graduate students page. You know, the SHRS graduate student experience, there's a short video here about that. And then, you know, our accelerated programs, what all do we have to offer? And of course, we keep sending people to sign up for an information session. More and more of our programs are doing these virtually. And personally, I'm really excited about that. It's a great way for students to learn more about the programs and hear directly from the faculty and oftentimes the students as well. Now, since we are here, Jess, is there anything that you want to mention about any of these pages? We also have our prospective international students page.
Just like to add that we will have a new application process for internal Pitt students for fall 2022, and are currently building out a page to include that information as well. We have requested internal Pitt students apply through Apply Yourself in the past, and the university is ending their contract with Apply Yourself. So we're in the process of working with Pitt IT to create that new application right now. And we'll have more updates soon.
And as we learn more, we will let you know.
Yes.
I also want to show you another page, but first I want to show you how to get there from any of our program landing pages. Like this one, we have this, what's it like to be an SHRS student? You click over, you are going to land on a Student Bridge kind of video site. And this is chock full of information. I don't think there were any like menus slots that we left empty. We really filled this up. So coming to SHRS, what do you need to do to prepare for the school? What's the undergraduate experience, the graduate experience? Let's go back. We have a page about academics, outside the classroom, community engagement, which is really a priority for the school. If you have students who are interested in healthcare and engaging in the community, have them reach out because we have a lot going on. There's a lot of opportunity. We also have a virtual map of all our buildings, and clicking on any of these, it will take you to virtual tours of all of these different spaces. So I know we haven't been able to give tours over the past year. We were very fortunate that we had created a number of virtual tours right before, you know, we couldn't be in our facilities anymore. So those have been a huge help this past year. There are videos everywhere and they're fairly short. So directing students here to learn more about SHRS as a school, if they want to know, you know, what kind of community engagement is going on, what kind of research is going on, this is a wonderful resource. We also have a new interdisciplinary case course that is available to all Pitt students. Really, anybody with an interest in a health career is encouraged to enroll in this course. Let's see, Kathy Kelly, are you around?
Yes, I just had to find my unmute button.
Do you want to give us a quick overview of what this case course is?
Sure. So it is, as it says, interdisciplinary. So there will be a number of disciplines, and I think, I don't know, probably 12, 13 different disciplines. Each week, the focus will be around a real clinical case, and then all of the individuals involved in managing the care of the patient or the client. So it really does give students a chance to see and hear about how the different professions interface with each other. And then, of course, one will be, more of a focus, but I think, they will walk away seeing that, nobody does this alone in the healthcare arena. So we're really looking, we built this course so that we could give students in their first and second years in particular, students who may not know about SHRS and the kinds of careers we have, or that they may not be aware that there are all of these health career options outside of straight medicine. So it should be really exciting, engaging. Again, they're going to hear about real people and real stories, some of which are going to be very, very touching and poignant, as well as informational. So yeah, we're pretty excited about this, and it will be starting in the fall.
So this is designed as a very interactive course. There will be Q&A sessions and panel discussions and hands-on experiences. We're also going to be incorporating some social student engagement opportunities for the students in this course and in the school. I think, if I remember correctly, the idea is to have those kind of social opportunities follow particularly intense cases to kind of lighten the mood a little bit after something that's maybe been a little bit of a deep discussion. We are absolutely encouraging incoming first years to enroll as well. So push this with your incoming first year students. Kathy, are these topics specifically focused on the fields that SHRS offers, or will disciplines outside of SHRS be included?
I believe both. I think certainly SHRS will be more focused, but certainly we will be touching on areas outside of SHRS, such as medicine for sure, pharmacy. I don't know about this year if there's any dental cases, but yes, we will certainly be incorporating that in the discussion, and perhaps even having some of those guests on the panels.
All right, and the last, this is not the last little bit. Heads up, we are reorganizing the SHRS Dean's office. We are adding a bunch of people. I think most importantly for you guys, it's to know that Kathy Kelly is our new Associate Dean for Academic Outreach and Advising. So you can reach out to her with really anything that you need. And if it's more specific, she'll filter down to Jess and I if that's appropriate. We are growing our recruitment and enrollment team. I'm very happy to say that we will be hiring 2 enrollment specialists over the next couple of months to help support our incoming and prospective students. So stay tuned for those introductions. We'll make those as those positions are confirmed. And something else that is exciting to know, SHRS is in the process of developing an advising office. Kathy, will you give us a really quick rundown of what that advising office is going to look like?
Sure. So we are, like Nicole said, in the process of developing what we're calling an advising as well as student success center, if you will. I know a number of schools have both of those as separate offices, where we are right now at least combining those two. But so this will be for us, centralize our efforts with respect to advising. And we're seeing advising in terms of certainly our students that come to SHRS that are matriculated, but we also will be extending our reach out to you all in terms of working with you for students who, might have an interest in coming our way. And so we will be, adding some personnel, in this office that, again, largely focused around academic advising, but also to what we're calling wraparound. At least that's the term I've been using in terms of wrapping around the student, anything they need to enhance their success in our school. Some of that, may be students who might need a little bit of extra support once they get to us, but also for students who want a whole lot more as well. For those students who might want research opportunities or, leadership opportunities, that could include perhaps things like study abroad, those kinds of, activities that are added on to their curriculum. So we are really excited about this and working closely with April Bellback to kind of give us some guidance around best practices with respect to, the sweet spot in terms of ratios of advisors to students. So for us, this is new, but we're really excited. There's a lot of this work is happening. It's just, we want to pull it together and then enhance it so that students really feel like I do have true wraparound with all aspects of their experience in our school. So we look forward to working with you and meeting
And
with
of
you.
course, once this has really started to build out and some hires have started to be made, we will be reaching out. Let's see, there's a question in the chat box. So not sure if you know this right now, but will you have any kind of walk-in advising for prospective students, like
Yes,
internal transfers?
I would like to say that answer would be yes, because I think it will really be important to have that presence and to have that openness. So, I'm looking to have, if this office, we would have somebody that would be there to meet the student who just happens to walk in or happens to be, doing a tour and wants to pop in. And if we can't give them all of the information in that moment, that we can definitely connect them. So that is the goal, to really be able to handle students at all walks of their, along their trajectory to get to us or to get to even thinking about a career in healthcare. Because even though we're going to be focused on largely on the undergraduates, we are going to be handing off to our graduate program. So we'll be working closely with them as well.
And of course, if you have students who are walking, if we have students who are walking in now, once we're back in the office, of course, Jessica and I are both available and have been taking those walk-in appointments as they show up. So yes. if in the meantime, we are still here and happy to support those students as they just kind of show up.
And we also have, Jess, you can certainly add more to this, but your open office hours are listed, for example, on the Pitt Health Careers site, right? So for students who might find themselves in that office space, we want to get them to us as well, if as needed. So we really are looking
as well.
Yes, to be really available to all stakeholders.
We have designated Zoom walk-in hours available every semester with the admissions office. We have one slot designated during the summer, but we typically have a bigger multiple day time slot available during the fall and the spring.
All right, I'm going to move this on along a little bit. We've got our faculty here waiting to chat, but I really can't emphasize enough. Stay in touch. Let us know when you have questions. We're happy to join your meetings. If you'd like someone to come and talk about one or some of our programs or admissions, you can contact us anyway. We're always on Teams, so you can chat us, email us, call us. And we will be hosting some monthly updates throughout the school year. This is going to be different from what we've normally done, but we have so much changing so quickly that we think it's really important to kind of give you the opportunity to come and talk with us really any time of the year.